All right. All right, let's start from home. Let's start from home, South Africa, from Charity. A big applause to Charity. Yeah, today she's not. I think her magazine is somewhere else. She don't have anything to fire. Just a report. Yeah, yeah. Okay, let's hear from Charity.
All right, okay. So in our group, well, my strategy was for us to kind of score different elements of youth engagement. So I'm not going to go through everything, but really what came out is that a lot of countries scored very, very low, which is expected because I think this is what we are seeing across the world, but there were some key examples of stuff that's working. So we had examples from Australia and Nepal, which spoke about actually including or having programs that include young people, ensuring that there is meaningful youth engagement, programs that specifically target education. In the US, there was an example about a program that's called Safety First, which really integrates which really integrates like harm reduction aspects. So there's really a lot that still needs to be done. We need to have systems in place that really disaggregate data, particularly relating to young people. There's a lot I can say, but essentially there's a lot of work that still needs to be done in terms of including young people.
Okay. For us in our group, like I said, we spoke about gender and drug policy. We looked at how, different folks experience different things in challenges in different ways, and why, when we are developing our policies, it should be gender targeted and specific. We also spoke about how, what is working. Rita mentioned in our space that, the decentralization of harm reduction services worked well for them in Kenya, right? Yeah, and then someone said we should talk intersectionality when policies are being written. Then lastly, we spoke about budget for gender responsive services. In the government, CSOs, we should be intentional when policies are being developed or written, when we find ourselves in those spaces, let there be budget allocated for different folks when we're talking about harm reduction services, and then build alliances and use the testimonies of women who use drugs when we're talking about policy development. Thank you.
Okay, so in building coalition and alliance topics, we are actually talking about many things, but what's really working on our topics, like in Nigeria, Australia, Nepal, South Africa, Tanzania, Kenya, there are good drug user coalitions and good relationship with government, and also in South Africa and Nigeria, they are making good links to human rights entities, and in Kenya there are strong expertise in people who use drug movement, and in South Africa they are building a vision for the crime in the coalition and a license. And for the challenges and something that we need to do more, like in South Africa, there need more links and license with media, and need to bring non-HIV actors into coalition across all countries, talking about support funding, new sustainability funding, and also there are a lot of people coming with capacity building, that we need capacity building for government.
Okay, so from our theme of using evidence for reform, we discussed a lot about like which community-led interventions we can use to generate evidence, and many suggestions are around the use of community-led monitoring, because it has been shown to be able to kind of like change the KPI for at the national level, or to change the clinical guidelines, or to offer real-time interventions that address the issues within the community. We also talk a lot about the research studies around values and preference, as well as how we can make data collected by civil society organizations, by community people, be seen as trusted data by the other stakeholders. And then solutions around that will be that we need to engage the government institution or academic institution in terms of like collaboration to get the co-ownership and to generate data, which is not just the data around public health, but also for whole person aspect of the data. Thank you.
Wow, thank you so much. Thank you so much. So let's hear from Gloria.
Yeah.
Thank you so much. I feel like that was an amazing discussion, and I was privy to hear all of you at the same place, so that was great. So basically, my name is Gloria Bile. I am with Regional Advisor for UNAIDS, basically working on prevention. So harm reduction is one of my buckets. So UNAIDS currently we have a new guidance note to pretty much trying to decrim drug use in the context of HIV. So I'm really sorry I'm not going to be talking without HIV, because a lot of work we've been doing with harm reduction has been in integration with HIV. So I'm not going to talk about the background and everything else. I think this is us. So I'll just talk about why we're doing this. So basically, this discrimination, drug use and possession of personal, specifically of the personal use, has been considered a key element in our work for ending HIV AIDS as a health public threat. So we've had a lot of work that has been done before. We have the UN Secretary General Political Declaration of 2021, from 2016 actually, with indicators. And also 2021, we have had to remove harmful and restrictive discriminatory laws that create barriers to HIV services. And then we have had the strategy that's finalizing now, that we just finalized now, and the new one. We have had critical indicators on ensuring that like, by 2025, actually now to 2031, less than 10% of countries will have laws that are criminalizing possession of small drugs, and then calls for this decrim in a community since the early days of the epidemic for HIV, and discrimination in different key populations. And also, we have now 29 countries that have reported in our data systems on decrim approaches, so we're lessons learned, and also have a lot of work still to be done. So why do we want to have this guidance? Specifically, is to provide guidance to government. So it's just a guidance note on what we've seen, what worked, what does not work, where we should stop, and what we should actually kind of integrate going forward. And most of this is just making sure that we have an enabling environment for people who use drugs to have services. And also we have together lessons learned, like I said before, in countries that can implement. It's not one fix all, so you can have always kind of find your niche to actually make this work. We have seen countries that have policies, countries that don't have policies, but still programs work. So this is just one of those we're working with. And also identifying practices that, or models of support that we can integrate into our programming. So why we did this is to actually involvement of a lot of key populations, a lot of networks, a lot of desk review on decrim in different countries and possession and what it means to have possession and how much can you have, how much can you not have. Then community-led consultations, like I see everybody talks about community because UNAIDS is basis of community. We work with community to do that. Consultation with a lot of group from experts, who drug users, UNODC, UNDP, WHO, UNITAID, because of the also measurements for drug use, and also just questionnaire to each and every of our countries. We have done this in 128 countries for each and country office, just to hear what programs are going into the countries and what they can do and how can we make it different. So basically the guidance note is more about the concepts of DCRIM, and I had people talking about what is the clear DCRIM, what does it mean? So the foundation, we have kind of different kind of foundations and principles and the laws that we have to work with. But at the bottom of it all, I think I don't think young people have been left behind, but also there's a fragmentation of work that we're doing, and community has to be at the center. So like everybody and everything else that we do with the foundation principles is human rights-based approach, public health approach. We're using about, it has to be non-discriminatory, it has to be voluntary, it has to be transparent and accountable. And also DCRIM is just the use of possession of drug use, that people have to know their rights, to know what to use and not what to use, and how can you actually fight for your own rights. So what needs to be reviewed, as I said, is possession of the drug use, consumption. We're talking about the purchase of the drugs as a personal use, cultivation of drugs for the personal use, sharing and selling of the drugs, and then pretty much at the administrative and the sanctions, and why we say that if you're found with drugs or if you're caught with drugs, it's not about the crime the person owes, it's just understanding the laws and what can work for you. So some of the determining examples that we use is like in many countries, there's some threshold inequalities and some restriction that we use to work with, and mostly we're looking at types of the threshold. So the binding, which we're determining, and also in the indicative. So evidence from the communities also in implementing reviews indicate that the non-binary threshold qualities where additional evidence is needed, majority of our criminal laws or our jurisdiction or justice does not know. So that I can hear, I've had a lot of information about informing the lawmakers, informing the community, informing the policy makers so that they know what the differences are. In some of the countries maybe where we've had good inputs, and some of the examples, I'll share this, is Portugal, Spain, Poland, Australia, and Canada. And a few of them have some of a kind of drug use. So pretty much the view of communities is very critical. There's no way we can move this without any communities being at the center of it and driving it. And some of the good practices of course, the criteria is distinguished between the drug possession and the personal use, and possession for the supply and profit. And then also just using this guidance note to ensure that we know what the thresholds are and what the qualities are, the methodologies of also determining the use versus supply, and the threshold of qualities and quantities, and the threshold qualities should be indicative. So the possession for the drugs and above the threshold amount should not be considered as criminal activity, but also without additional evidence. So this is kind of a guidance just to help us to rethink and how we can actually manage to use support efforts in the communities, and especially when we're doing our interventions at the country level for the people to help us with the policy that we're making. Thank you.
He's scaring me.
Yeah, thank you so much, Gloria from UNAID. And before we come to an end, there is this QR code. Please join the mailing list, because all this that you contributed will be sent to you. How sweet is it? Yeah, have you ever been in such a workshop before? I guess not, yeah? All these that we've heard and we've spoke, particularly the last presentation from the UNAIDS, as I said before, we have the agreement that we have problematic drug use policy. Number two, we have the channels and the chapters that we can follow to unwind that. And number three, we have the data, we have the details, and at the same time, we have roles and responsibilities to play, because rights comes with responsibility. And lastly, we have questions. We need to ask ourselves, who is the problem? And I normally say, I want to finish by saying, if you want to know who is the problematic person, just go before the mirror. You will see that person. So it is our problem, it is our solution. I believe we have the problem, but we also have the solution. Thank you so much. I have been your chair, Ahmed Said from the regional coordinator of African Network of People Who Use Drugs. And we really thank Elton John's Foundation, led by Tom. We thank the technical team behind there for making sure these microphones and everything are working. And we thank you as participants and facilitators to make this workshop real. Thank you and have a lovely evening. Let's have some sort of a group photo, and then we call it an evening, yeah? Yeah, let's have a group photo with our facilitators here.